my background and experience. Yes, I've always wanted to come into care. Um, if I look at when I was growing up, I see myself as a caring person. Um, my dad called me compassionate boy. So, and when I did my first placement in voluntary activity in the community, because I volunteered for 5 years, working in community care, day center, helping people with recreational activity. So I find out that it's very important to have time for people, to listen. Although when I came into the UK, my communication wasn't very good. But spending more time listening kind of give me more confidence to engage with different people. So when I finished my voluntary, I think I did a voluntary for 5 years, and I studied diploma in health and social care. So I kind of know that when it comes to care, there's always something we call clinical practice, which I wasn't really good at. I don't know what that is until I went for NHS practice skills. I did my training with OFC Training College, where I learned clinical practice, how to do news observation. So sometimes I think majority of my education experiences help me to think that a care job is for me. I've had the education, I have experience, and I know I'm kind of a friendly person, and I like listening to people when they talk. So in care job, and I know listening to people is one of the key skills that is needed when it comes to dealing with difficult situation. I don't really see care job as something difficult because I think I've been working in mental health hospitals. I work in community, supporting the homeless. One of the challenges I think that people think that is difficult when people are unaware having cognitive impairment, when they are having mental health problem, and people who doesn't understand how to listen or how to communicate clearly to patients, they find them difficult. But some of the time, majority of patients I've looked after, one of the joy I have is that when they come in, they look very unwell. But when they are going home, because I've managed to support different multidisciplinary team, because the doctor had to set up a care plan with the nurses, the manager, they put things together that when you go into patient care plan, you can actually see what some patients need. Some of them need like recreational activity when it comes to painting, reading. Some patients just want you to have time for them. So sometimes I know people can be unaware, they can be aggressive. The patients are very violent when they're mentally unaware. So another thing I observe is that when you speak to manager or speak to your nurse in charge, they can actually give some support by directing you to the right team and knowing what to do in order to support that patient. So they also offer us, I like mandatory training in health and social care. Although I've been doing lots of training online, there are lots of free training which I've been doing before I find the OFC Training College that support me when it comes to work-based activity, work-based job. They help me to know how to communicate clearly in care and how to do lots of clinical practices. So now PMVA, there's PMVA. I don't know if you know about PMVA, a training that you can do to be able to learn how to manage people who are aggressive, who need extra support, and in terms of providing evidence-based care. So yes, I think it's about getting the right training, having the right support, and knowing who to speak to, because some patient doesn't really want you, and doesn't mean they don't like you, but they are aware when you speak to the right person, you get the support that the patient actually. You ask me what are my strengths and the area I need development. Um, I'd say my strength is being confident, having the understanding of professionalism and trust. If I don't know what to do, I will always ask. It doesn't matter how many experience I have in care, but since I've been in care, I know that there are different patients, there are different individuals. So I understand when it comes to patient-centered care, providing the care that is individual based, you need to always make sure you provide care that is individual based. So some of my challenges is that when I come onto the world, maybe if I go on holiday or I start new job, you find that you have new patient, you have new staff, or you've had to do some of your training that you need to be able to get the gap or close the gap of the thing you haven't known for a long time. But I think I've managed to understand now. Anytime I'm coming from my holiday, I always make sure I attend handover on time, which is some of the things that I know everyone requires support for. You can get more information when you attend handover, check my patient care plan, and always make sure I speak to my manager and my nurse in charge to give me induction on how to deal with individual patients. So say, for example, if someone is doing one-to-one, if I'm taking over, I always make sure they give me handover to tell me about the patient, do's and don'ts, or maybe what they want, mostly risk assessments. It's very important. I learn more about that as well. But to your own organization, I don't understand your policy and procedure. My past experience, they usually have where they teach you how to do patient observation based on the trust policy. So, so you might want to tell me what your organization is having to offer in regard to training, induction, and all that, so that the patient will be easy for me to manage. You ask me, where do I see myself in the next 10 years? Oh, 10 years is a big word. I think I remember 10 years ago, I always learn something when it comes to organizing yourself, creating plans. So I like doing 2 years plan, 3 years plan. Sometimes I meet up my plans in 6 months or a year, especially when you are organized. So now, as a support worker, band two, I need more understanding of how to develop myself to be band three or band four, because I've completed my care certificate, I've completed all my mandatory training. So I think to be a registered nurse is not bad. I don't know what kind of support or development opportunity do you have. So in the next 5, 10 years, um, firstly, I know this is not part of my job. I would like to get married and maybe at the same time have more qualification to be a nurse and have a new car. Though my car is not, it helps me to go to work. And at the same time, when I talk about nursing, I saw the 6C in nursing, which NHS value is very good, but they mostly based on nursing practice. So sometimes in leadership, there's a little voice you have as a band two. However, having more chances to be in a leading team, band three, band four, or maybe nurses, I will be able to have more chances, more knowledge to support the patient more. So in the next 10 years, I want to be a nurse or maybe ward manager. So I don't know, it's not bad. How do I gain motivation at work? How do I gain motivation at work? Most of the time, some of the things that give me confidence to do my job is when I come to work on time and then able to check my patient care plan and knowing what my patient wants. At the same time, having my reflective practice. Sometimes I book my supervision. So I speak to manager or my supervisor if I'm not happy or if I need any challenges solve or something that is bothering me. I always speak to my supervisor. Anytime I speak to my supervisor, because he always direct me to the right development need in order for me to provide my patient the best possible care outcome. So I think that's the area I would say is talking to my supervisor. So it gives me more confidence, and it makes me happy. And also, I've been doing this job now for over 5 years. So I've been a carer for over 5 years. When I was working with my first time with NHS, some of the things that support me, and no matter how difficult it is, if I manage to get my supervision, and then sometimes my supervisor will just say, okay, if I request for holiday, because I like holiday, because I like walking, I like going for long driving, and at the same time, I also like going for like the waterside area, the beach area. So when I go there, I normally have a chance to see fresh air and relax. So when I come back to work, it gives me more confidence to know that yes, I can do this job.